Dr. Burt here. Hey, wanted to jump on to record this video really for the CCI community, and that's Craniocervical Instability community. And I've seen a lot of patients with CCI and suffering from CCI symptoms over the last few years, and I realize a lot of them have questions. They don't really know how to go about it. They don't have a roadmap, and so that's the purpose of this video, really to provide a roadmap for these patients. And this CCI, it should not be taken lightly. This is a serious condition, and it's not necessarily a new condition, because we as doctors have learned a lot more about CCI in the last decade. But the truth is that there's not many treatment options for people with CCI. So it's really important that this information is covered and conveyed so that the CCI individual feels more confident in their decision-making process, that they know that they're heard, and that they can really find a long-term solution. Because people, the more research they do, the more they realize an option is surgery. And there's a lot of times people, they come to me and they don't want to do the fusion surgery. So we definitely want to make them aware that there is more options available. Now, I got into CCI about 5 years ago when a new patient scheduled an appointment with me, interested in NUCA upper cervical chiropractic. And little history on her. She was 25 years old and really was involved in a bad motor vehicle accident. Both head and neck was injured, whiplash and concussion for her. And, she went the traditional medical route. Medications were prescribed and physical therapy. And she just really wasn't getting better. Things were getting worse. She was really doing a lot of research after that because she wanted help. And so there wasn't too many resources available. But she had all these symptoms, right? So dizziness, headaches, neck pain, brain fog, nausea, the light and sound sensitivity. She could barely handle the lights in the office, and that all kind of gave her a lot of anxiety. And, because these symptoms were getting worse, she came across Dr. Centeno, Colorado, and he wrote a book called CCI 101. And in that book, Dr. Centeno does a great job of kind of outlining a roadmap for these patients and for people with CCI. And so in that book, he provided a recommendation for a NUCA upper cervical chiropractor. And so that was cool, and that's how she heard about me, and that's why she scheduled. Of course, she had learned about the other treatment options like prolotherapy, like stem cell injections, but she was already stretched for funds just because of having to pay out of pocket trying to get this figured out. And so at the time, it just made sense to start with upper cervical chiropractic because it was a lot more affordable to her than some of the other options. Now, she did not like the idea of a fusion surgery after researching that really the surgery was designed to help people that had broke their neck, and it really wasn't for people with CCI. And she talked about some of the internet reviews that she had read on the surgery and basically was not interested at all. And I'm really happy that she did give upper cervical chiropractic a try, because it worked out for her. And after her first adjustment, she felt immediate relief. And she said she felt a lot more stable in her upper neck. She didn't feel like that bobblehead sensation, and her energy was better. And she walked out of the office without her glasses on, so she wasn't as light sensitive. And so all in all, she was really happy to continue the process, because at the time, like when she left, her dizziness her imbalance was still there. So obviously she knew that needed a little bit more time, but she was willing to give it a shot. And so for me, after this experience, I of course picked up Dr. Centeno's CCI book, started reading it, learning more about CCI, learning more about the PICL procedure, and learning about prolotherapy and posterior injections, and slowly started really working with these doctors, Dr. Centeno, Dr. Schultz, Dr. Hauser, Dr. Michelle in Florida, and then local naturopaths like Dr. Ryan Wood. And so since working with all these doctors, I was just looking at the numbers. I've seen 83 people now that have had some sort of ligament laxity in the upper cervical spine. And so with this data, 92% of them reported that within 1 month of getting their adjustment that they had relief. And so now some of these people had prior injections, some were scheduled to have more injections in the future, but regardless, every single patient had a plan and a roadmap for how to go about their CCI, and they felt confident that they were in the right hands with the right doctors and they had a plan. So let's jump into the roadmap. We'll talk about CCI. What is it? What causes it? What symptoms are associated with it? How to diagnose it and how to treat it. So CCI really is a condition when the upper neck bones, the head, the atlas, the axis, they move around too much due to loose and stretchy ligaments. Now, the two biggest causes of CCI are predisposed loose ligaments and trauma. Now, what causes loose ligaments, we really don't know. But there's a few theories that are circulating. Theory one is that predisposed loose ligaments may be caused by chemical toxicity. And so this can be pollution, heavy metals, pesticides or herbicides in our food, and other toxins that we put in our mouth, put on our skin, from that nature. So theory two is that loose ligaments may be caused by a nutrient deficiency. So not enough bioavailable vitamins, minerals, enzymes for proper collagen strength. And it could be a combination of both, chemical toxicity and nutrient deficiency. Now, it's also important to mention that there are certain people out there that are predisposed, whether it be loose ligaments or even certain conditions such as EDS, hypermobile, Ehlers-Danlos syndrome. And so these people are already hypermobile. They're much more likely to develop CCI compared to someone without the hypermobility. So this is a good segue into trauma, because trauma being the other cause of CCI, if someone already has a hypermobility disorder and then they have a head and neck trauma, the risk of getting CCI increases substantially. And, some doctors would even say it doubles their risk of getting CCI. So, and then on the other side, let's say someone doesn't have hypermobility disorder, but they do have a head and neck injury. Let's say they get in a car accident, or they get a concussion playing sports or do something at work. And so they can still get CCI. Now, the most common symptoms someone with CCI is going to get are going to be headaches, neck pain, neck clicking, popping, grinding sensations. They're going to be dizzy or feel a sense of imbalance, visual disturbances, rapid heart rate, light and sound sensitivity, brain fog, and fatigue. So the gold standard diagnosis for CCI is going to be the digital motion X-ray, DMX. This test is exactly as it sounds. It's a motion X-ray. So this machine can capture up to 30 images per second to evaluate the upper neck ligaments. And so everybody that does this test is going to go through the basic neck ranges of motion. They're going to turn as far as they can to the right, as far as they can to the left. They're going to do that a few times. Then they're going to go as far up, as far down a few times, and then they're going to go side bending ear to shoulder as far as they can to both sides. Now, after you complete the test, then the doctor is going to write up a report to determine, do you have either ligament laxity, or is the amount enough to where you actually have ligament instability? Now, there is a difference between laxity and instability. The way I understand it is that the difference between ligament laxity and ligament instability is the amount of millimeter overlap. So if a patient has 3.4 millimeters or less of bony overlap or intersegmental translation, then this is considered ligament laxity. I don't believe that this qualifies as CCI or instability. Now, if the millimeter overlap is 3.5 millimeters or greater, so 3.5 or more, this does in fact meet the criteria for having instability. Therefore, that doctor can now diagnose them with CCI. Again, I may be wrong on this. My source is going to be page 392 of the AMA guide booklet. and that's going to constitute a permanent ligament impairment. Now, regardless of whether you have laxity or instability, that may factor into how many upper cervical adjustments you might need, or how many prolo or stem cell injections you may need. So while the DMX is the primary test for CCI, there's definitely other tests out there that can help evaluate the ligaments. Now, because I don't have a DMX, I do have an X-ray though, and I love the X-ray because it allows me to screen for CCI. So although I can't have them do it in one motion, what I can do is take 6 different pictures to at least screen for the instability. So those 6 pictures are going to be right rotation, take a picture, left rotation, take a picture, look up as far as you can, take a picture, down, take a picture, ear to shoulder, open mouth to move the teeth out of the way, take a picture, other side, left side, open the mouth, take a picture. So all those can allow me to screen for CCI. Again, not diagnose it. Now, if those tests come back positive, then that's an appropriate referral to DMX, but I at least like to do that in my assessment to screen for it. Now, the same thing can be used for upright cone beam CT, CBCT, and so that's going to be 6 different scans in each range of motion, right? So rotation, extension, flexion, side bending. Now, with an MRI, you can actually see the ligaments, but MRIs are a lot more expensive. They take a lot more time. And the real problem is that most machines, you can't get the full range of motion to get a true measurement. And I've seen this in my own patient where she had finally got authorized to get an MRI. You know, her insurance was going to cover it. It took 6 months to get it approved. But when it got approved, she went in for the MRI and she was doing the motion and she couldn't even complete the motion because the machine was in the way. It was like blocking her. So she went to tilt as far as she could and her head was hitting the machine, and because it was too small. And so what happened was actually terrible. Like, the outcome completely backfired on her. The doctor ended up writing up the report saying that she didn't have any problem, that there was no laxity, no instability. And the reality was that it was a faulty test. And so it was just a terrible. And there's upright motion MRI. Now, the benefit of an upright MRI is that the soft tissue structures, they're being influenced with gravity, opposed to a standard MRI where the patient's lying on their back. So you do get gravity's influence here. All right, getting into treatment, how to treat for CCI. Now, of course, this is going to be person dependent. Everybody's on their own journey, and some may have tried certain things before other things. So although the roadmap that I'm going to recommend isn't necessarily the gold standard, but I will organize it in a way that is kind of based on affordability in case nobody's tried anything for their CCI. And the way I organize it like that is because a lot of these treatment options and services are not covered by insurance. And so most people are going to be paying out of pocket for this, so I want to take that into consideration. Anyone with any possibility of having CCI should get started with a qualified upper cervical chiropractor. And so this is a special kind of chiropractor trained specifically in the upper neck, and the upper cervical adjustments are completely safe and gentle. Now, you can find this type of chiropractor on 2 different websites. One is nuca.org, nucca.org, and if you can't find someone local to you, then you can go to uccnearme.com. Now, the first thing your upper cervical chiropractor is going to do, or what they should do, is that they're going to walk you through a in-depth neck assessment. Now, depending on how you do on the assessment, they'll likely recommend upper cervical adjustments. Now, the goal of these adjustments is to help gently realign the head and the neck so that way the upper neck soft tissue structures are not compromised. So that way the brain can heal faster, the nerves can heal faster, the blood vessels, the muscles, everything should heal faster when you're in alignment. Now, another thing your upper cervical chiropractor should do is take at least 4 of the 6 static X-ray scans, because not every upper cervical chiropractor is going to have a DMX in their office. But most do have either a cone beam or a x-ray units. And so if they can just get 4 of the 6, so that's flexion, extension, side bending right, side bending left, open mouth, and when they measure those scans, if there's at least a 2 millimeter overlap of intersegmental translation, then it would make sense for you to go get that DMX scan for a more proper CCI diagnosis. Now, depending on how much your symptoms are improving within the first few months of getting adjustments, and also depending on how well you're holding and maintaining each adjustment, then you can begin physical therapy. And most times I find that patients do it the opposite. They start physical therapy before getting their head and neck aligned. And those exercises are being done when the muscles are already tight and spasm. And so it just doesn't work as well. So ideally we have the adjustments and then we have the physical therapy. And now that the muscles are getting stronger, then what you can add is prolotherapy or posterior injections. And posterior injections meaning the injections are going to be injected in the back of your neck. Now, prolotherapy is a sugar-based solution designed to really tighten down the upper cervical ligaments. And so that's going to further bring you into alignment. That's going to help you hold and maintain your proper alignment longer. It's going to help upper cervical chiropractors with their work, and it hopefully will help you resolve any symptoms that haven't been already corrected. Now, a typical course of prolotherapy is going to be about 4 to 6 injections spaced out roughly every 6 weeks. Now, I know most prolotherapy is going to be injected into all the facet joints, all the neck muscles, the origin, the insertion, the nuchal ligaments. And so there's definitely a few other areas, but they're really good. They use the diagnostic ultrasound to know exactly where the prolotherapy is going. Now, if you've tried all these options and you're still looking for more relief, then you can see Dr. Centeno in Colorado and opt for the PICL procedure. And so that's going to be where he uses bone marrow stem cells from your hip, and then he's going to inject those through the mouth, which are considered anterior injections because he's going through the front. And that's where some additional upper cervical ligaments are to help that area heal and strengthen. And of course, the last resort is going to be the fusion surgery, where they'll probably, and I say probably because I'm not entirely sure how the surgeons do this surgery. I know there's a few different ways to do it. Some go 1 and 2, some go 0, 1 and 2. And so there's a lot of different ways. And again, full transparency, I have never had a patient that has needed the surgery. I've never seen a patient that has had the surgery and then come and seen me. So I really don't know too much about this. But I do know that there's been a lot of my patients that come to me and basically it's not an option for them. So we're truly hopeful that they can get relief by doing some of these other options. So to wrap this up, let's summarize. If you have CCI, then I think this is the roadmap that makes the most sense given the success that I've seen over the last 5 years. So it's best to start with an upper cervical chiropractor, and that's going to run about $2,000 to $4,000 over about 3 to 6 months. Then physical therapy, which is about $1,000 to $3,000 over 3 to 6 months. Prolotherapy is going to be about $4,000 to $50,000 over about 3 to 6 months. And then the PICL procedure, I believe, starts at about $15,000. And then depending on how many injections you need, I would say in my experience, the average in my patients is about 2 to 4 injections. I've had one patient that needed 5 injections, but he was also really injured. And then also you're going to have to factor in more tests when you see Dr. Centeno, because he also is going to require a supine MRI and a motion MRI. And then surgery is probably going to run about $50,000 to $60,000. So the last thing I want to say is a little bit on nutrition, because a lot of people with CCI, they don't understand nutrition and how they can use that to get themselves to be stronger, to get their ligaments stronger, their collagen stronger naturally. And so there are specific foods available to us which contain the exact nutrients, minerals, vitamins, bioavailable enzymes to help the ligaments heal. And not many people know what these are. And so if this is any of interest to you, I would encourage you to schedule a video consultation with me, and I can teach you this information. I can share these recipes with you. So if that interests you, just let me know. Happy to walk through that with you. Link will be in the comments. I hope everybody learned something new with this video. Take care. Video consultation with me, and I can